Good morning, guys. I hope we're all sparkly. Today we're going to talk about the symptoms of low testosterone. I've just had a symptom of low testosterone, brain fog. I forgot to press record. So, having healthy male androgen levels does not mean you will never have a symptom of low testosterone ever again. Wouldn't it be wonderful? Testosterone cures all. But the symptoms of low testosterone are all quite vague. But when you piece them together, it gives you a clue as into what might be going on. And you should always think about testosterone deficiency as a diagnosis of exclusion. Let's list them, shall we? Troublesome fatigue. Brain fog, which I've just had. Low libido. Low mood. Anxiety. The list goes on. Now, there are lots of causes of each individual symptom, and you should always be looking to address the things that you can positively impact without needing medication. Prevention is always better than cure. But if you need testosterone replacement therapy, you will 100% benefit from TRT. With the correct levels, you should have the drive, the determination, the motivation to get up off your butt and go earn your reward. Testosterone does not make you happy. It's not supposed to. Testosterone does not give you the reward. It gives you the ability to seek the reward. Why? Why doesn't it make you happy? When I up my dose, it makes me happy. Well, what's happening there? You are artificially manipulating your testosterone level, which is having a subsequent knock-on effect on your dopamine. You are artificially increasing your estrogen, which is essentially having an effect on your serotonin. So you do feel good with a protocol change, but that's not sustainable because that's not real life. Now, again, we go back to the premise behind TRT, normalizing physiology. You don't want to be super physiological because that's supra, above, physiology, which is how a living organism functions. You don't want to be above how a normal organism functions because it's oh my word. So testosterone follows a diurnal pattern for a reason. Your testosterone is high in the morning as you've been growing and repairing and preparing overnight when your anabolic processes are predominant. You have a high testosterone in the morning and a high cortisol in the morning to give you the ability to get up off your butt and go earn your reward. Said it before and I'll say it again. Hunter-gatherer, wake up, go hunt, go gather, earn your reward, have a bit of nookie, go to sleep, job done, rinse and repeat. Your body doesn't care if it's the week or the weekend. Be physically active. Use all those stress hormones and neurotransmitters that are firing because of the misdirection and nonsense that goes on in our modern world effectively. Anabolic processes predominate at nighttime for a reason. You are supposed to be alert in the daytime. I talk a lot about bad habits with my patients, and I speak about alcohol quite frequently because it's one of the commonest drugs that people abuse. However, they think that they use it. Now, obviously, alcohol is an interesting drug because it's everywhere and it's not perceived to be the bad guy that it really is. Lots of people think that they are okay with alcohol. I'm okay with alcohol. Am I? So what are you doing? Imagine a dial. You're up at 10. The weekend comes. I want to turn that dial down. I think I've earned it. So you drink alcohol. It decreases your consciousness. It brings about a level of calmness. And that's wonderful, isn't it? Alcohol is a wonderful drug. Alcohol is poison. You are decreasing consciousness. In no other animal species would you find it decreasing consciousness deliberately, because it's got to survive. And because we don't need to survive, we think that we can turn down the dial to 0 and be okay. But what happens when you come off of alcohol? Lots of people turn that dial back up to 11. So what's going on? Essentially, when you drink, you decrease glutamate. And when your alcohol has left your body, those glutamate receptors are super anxious, super hungry for glutamate, which is an excitatory neurotransmitter, which is why you have a spike of anxiety when you're not drinking. Only to recover over the next few days to go, oh, I feel pretty good, let's have another drink. Rinse and repeat. Sad but true. Essentially, what's happening is your body's recognizing the fact that there was a time of decreased consciousness, and it doesn't like it. And it's going to fire hard to find out what the hell's happening, what went wrong. I don't want to go through that again. So that manifests itself as anxiety. Isn't that fascinating? You can kind of work all this stuff out if you have a logical mind. So when it comes to low testosterone, obviously you've had all these horrible negative symptoms of low mood, anxiety, depersonalization, etc., etc. And we don't want them back. We want to never have a negative symptom ever again. Is that realistic? No, don't be retarded. But with healthy hormone levels, it will hopefully give you a perspective that you lost with low testosterone. With low testosterone, you never saw the reward for your effort. And life is all about moving forwards. So it's disappointing that you put the effort in and you don't see the reward. Now, again, we turn to the path of least resistance because we want to conserve energy and achieve a maximum reward. But the path is mistakenly trod because we are not earning our reward. And if you artificially give yourself the reward chemicals, you dysregulate your physiology. Disappointing, isn't it? Again, you can break down each drug. Cocaine, dopamine, ecstasy, serotonin, opiates, again, endorphins. If you artificially take a drug or you artificially manipulate a neurotransmitter, it's artificial. And what should we be aspiring to achieve? Normality. Does normality sound boring? Not really. Your DNA wants you to fight, and your DNA wants you to fornicate. Literally, that's what it wants you to do. It wants you to be strong enough to protect, to hunt, and it wants you to have the capacity to procreate, which means libido, erections, bada bing. But they're two different arms. Now, I've spoken about the seesaw effect before. On one side, you've got your excitatory neurotransmitters, adrenaline, noradrenaline, and your cortisol. And these are firing constantly because they're keeping you alive. And keeping you alive is important. So that's the fighting part. On the other side of the seesaw, you've got the parasympathetic nervous system, your rest, relaxation, social engagement, and your anabolic hormones. Yes, your anabolic hormones are calming when they're balanced. When they're in excess, you know you can be a bit of a plonker. So, boys, good fun for 10 minutes, but an absolute pain in the arse afterwards because they lack a level of objectivity, empathy, and insight with dysregulated hormone levels. Again, what is the body trying to achieve? It's trying to achieve balance and stability, homeostasis. If you don't know what it is, look it up and understand the complexities involved in this process. They are working constantly to maintain a stable environment despite external changes, with contrasting processes going on within your body. Your body is incredibly complicated to make your life incredibly simple. Concentrate on what? Lifestyle, stress reduction, sleep hygiene, minimizing booze, diet and training, rinse and repeat. We're the only species that has to think about its health. Isn't that bizarre? Our higher state of consciousness should be helping us, not harming us. But animals live more by their instincts. They live in a natural environment. Stick an animal in a zoo, it's going to become depressed and it's not going to eat. Stick an animal in its natural environment, it will live according to its physiology. So what is so wrong with society? How long you got? So low testosterone. Cardinal symptoms: fatigue, brain fog, low mood, low libido. Physical symptoms: lack of lean muscle mass, increased visceral fat, the dangerous fat, decreased bone mineral density. Yeah, we've had somebody present to clinic with actual osteoporosis. How scary is that? Anemia. Obviously, testosterone is involved in red blood cell production. So a rise in hematocrit to normal, not above normal, because supraphysiological is above basic English. Okay, so you can have anemia as a result of low testosterone. But with healthy hormone levels, again, healthy hormone levels, it gives your body the fighting chance to allow you to do what? What is it? Earn your motherfucking reward.